Mark Butler, the federal and state governments are blaming each other for the lack of rapid antigen tests, but isn't the fact that both levels of government have failed on the supply question?
Well, at the end of the day, I don't think there's any question, Laura, that the responsibility for securing supply in global markets of rapid antigen tests rests with the Commonwealth, just as it did in relation to vaccines. And this has been another gross failure to take responsibility and to plan for this next phase of the pandemic and secure enough rapid antigen tests for the whole community, business and working families alike, to secure it at a price that means that the government could provide them free of charge, and to set up a national reporting system of the type we see in countries all around the world that will allow people to upload the results of their tests to public health authorities. I mean, he should have planned for this because he was warned back in September by the AMA of the centrality of a comprehensive rapid testing strategy to the next phase of the pandemic. Yet again, he's failed the Australian people.
But National Cabinet actually signed off on a transition to rapid antigen tests last August. It wasn't just the Prime Minister, yet the states are only now starting to roll out systems to register those tests. Shouldn't they have been more prepared?
The Prime Minister and his government were warned not last year, the year before last, that industry should be supported to set up domestic manufacturing capability of rapid tests here in Australia to secure the supply of these crucial public health measures. But the Commonwealth could not have been less interested. So as a result, you've got factories churning out millions of tests here in Australia that are sent overseas when Australian families and businesses, for love or money, can't get their hands on one here in Australia. You know, in a squeezed market, the Prime Minister simply didn't act quickly enough to make sure that Australia had enough tests for this next phase of the pandemic. He hasn't set up a system for those tests that do exist here in Australia to be provided free of charge, and we should have a national reporting system. I mean, we're a single country, Laura. The idea that states keep having to step into a vacuum left by a Prime Minister who refuses to take responsibility for his job is just, I think, an indication of his failures through this pandemic.
Well, given your criticisms of supply and putting it back on the Prime Minister, why did it take you so long as an opposition to crab walk your way towards that position of saying that, that the test should be free for everybody?
Well, we said very early on, just as this debate was starting, that we would be guided by two principles. The first, that these tests had to be widely accessible. We had to have lots of these tests in country. And second, they should be affordable, that income should not be a barrier to people being able to get these tests and to take them when they thought they needed. Now, after talking with stakeholders, we developed the view they should be free of charge. We didn't do that overnight. We engaged with stakeholders and carefully came to that view. But I have to say we particularly thought we needed to step out that position when the Prime Minister on the morning of the last National Cabinet meeting came up with this ridiculous idea that pensioners would need to line up and make some application for disaster payment to Centrelink or to Services Australia to recoup the costs of rapid tests. But the other 3/4 of Australians would be completely left in the lurch on their own to fight it out in this private market that Scott Morrison seems so intent on trying to support.
Isn't it the case that the lesson of this pandemic, and particularly of Omicron, is that the hospital system, the health system, are going to require continuing high levels of funding? What's Labor's position about how that's got to be done?
Well, it's quite clear that our hospital systems around the country increasingly are becoming overwhelmed. Hospitalisation numbers climb day upon day upon day, and thousands of staff, particularly in the big two states, are furloughed or in isolation either because they have COVID or they're close contacts. So I think everyone is deeply concerned about the ability of our hospital systems to get through the next several weeks. Beyond that, I think obviously we're going to have to see what sort of resilience our hospital and our primary care or general practice systems have to deal with the next phase. I mean, health workers are exhausted. Nurses tell us that. Doctors tell us that. Other health workers tell us that. You know, we said late last year, as did many, many others, that the National Cabinet needed to consider the resilience of our hospital systems as we move to lift the lockdowns and open the borders, as everyone wanted to happen. What was the plan to make sure our hospital gets through that? Now, Scott Morrison assured people our hospital systems were ready, they would get through this next phase, and I think he'll be held to that promise.
Mark Butler, thanks for your time tonight.
Thanks, Laura.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.